So welcome. We're going to talk about Yubi Health's innovation within the mental health space. Mental health is sort of like a personal topic to a lot of us who started Yubi Health. And our adventure into this area is, very much like on the back of some of our family members, friends, losing their life to mental health or dealing with some of the challenges in mental health. By background, I'm an engineer, and I say that because, of course, right, we're delving into a little bit of a clinical territory over here. But fortunately, from the work that we have done and the people that have come around us, there has been a lot of clinical doctors that are involved in this work in creating a solution which is backed with AI, but also has its roots on the clinical side as well. So talk a little bit about the typical landscape or the problem area today, right? So mental health, if you look at the broader landscape, it's a 2 trillion plus problem in United States. There's a large percentage of it is, of course, medical cost, but there is also, underneath the iceberg cost, which is a very heavy cost itself. There's a lot of studies that has been done on this area, in terms of how does mental health affect the physical health and vice versa. One of the major ones I've seen is in the recent years is around 57% of your overall healthcare expense is attributed to mental health. Mental health alone in that is only 4%, but the combination of physical and mental health is about 57%. So, people might be getting, diagnosed and treated for physical health issues, diabetes, some of the other issues, but there is definitely, you could see an overlap into the mental health and similarly, mental health into the physical health. Now, largely, if you look at a lot of the AI or innovation work that is happening in the mental health side today is much more focused on much more focused around helping patients navigate the system. And so where we started focusing on is around why does, where are the point of correlations between the physical and mental health? How do you identify some of those areas? And then, how do you bring a person maybe, start intervening from early on onset versus 3 or 4 months down the line, which is also a very critical piece because in the larger context, 70% of cases go undiagnosed and underdiagnosed, which means, they have maybe in the earlier stages or there isn't a good understanding of what a mental health issue is. Now, good thing is with the pandemic, we have seen a lot of education around this, a lot of awareness around it, which is certainly helping it. But still, between the physical and mental health and how we operate in the healthcare system, there is a fairly big gap. And so when you do end up going at a provider, there is a big focus on, what particular condition you have, and then how do you treat that condition, but not necessarily looking at why that condition happened. So how do you, how do you address challenges that might be creating a mental health issue? Some of it could be, more environmental factors, but other could be much more deep-rooted clinical issues as well. So we kind of look at both of them. So what we did is we created a solution which is very much rooted into the clinical functional side of it, where the big focus is on understanding, why somebody is having a mental health issue. And when probably, you could start to see the onset and then the entire application of it around how do you solve for those challenges. So I'll give an example around stress. And this is what I quote a lot of people. And in our work, pretty much everybody faces stress. A lot of people deal the stress in a lot of different ways. But from a functional or clinical standpoint, one of the aspects of stress is in terms of how your adrenal function responds to stress. And so if you have chronic stress over a period of time, you will start to have adrenal fatigue, which is again one of your organs that is, secreting cortisol to balance stress and stress-related issues. And once you have that fatigue, your stress response or the adrenal response goes down, and then it starts to manifest into so many different ways in both physical and mental health side. So with our application of AI into this area, the data that we collect, we are able to determine where exactly we are seeing, some of those issues, and how do you then start to kind of create a treatment plan or a care plan for an individual. These are some of the people that are involved, deeply involved with, kind of building up of our solution in terms of, their clinical knowledge, their background, and how we applied that to bring about the whole solution to life. Now, where we are implementing or where we have implemented our solutions is in primarily two major areas. One of the big ones is in the remote patient monitoring side, which is where we have seen tremendous value coming out from the physicians, the psychiatrists, where they're able to now manage their patients not only outside the clinic, but they're also able to understand much more deep-rooted issues that previously they didn't had enough time to delve into or had a good understanding. So now, to give an example, some of the physicians that have onboarded our solution, they've been looking to kind of create an integrated physical and mental health care team. And so with our application, they've been able to at least cover that gap by almost 80 to 90%. So from what we are collecting from a data perspective, and that is powering our AI, there is a lot of passive data collection. There is active data collection also that we are focused on in terms of some of their daily data from the watch, as an example, or any Fitbit device and things like that. And then there is the aspect of continuous data collection, which helps us to understand how they've been progressing with the overall care methodology as well. So are there ways that certain things needs to be adjusted, self-adjusted, and so forth from the overall care perspective? So I talked about one of the application is in the remote patient monitoring side, which is where the physicians are seeing the biggest advantage. So if we talk about the benefit or the value to the providers, we see it in manifold, beyond the aspect of the monetary side as well, right? So I think a lot of physicians, you will see psychiatrists or psychologists in this area, I feel they genuinely care about their patients. So their concern is not like, oh, we are already full, but like it's about how do we create the best outcomes for our patients. So the big focus is around, they being able to understand how a medication is working for a patient, because now they are getting that data, active data, in almost real time, and able to monitor and see how the patient is improving. They're able to instrument member onboarding. So there is a lot of self-reported information that also comes in as part of the member onboarding piece. They're able to also leverage maybe additional levers with a wellness coordinator, therapist from their office to have a continuous check with the member without necessarily needing for them to come into the clinic. And then, of course, like I talked about the entire physical and mental health view, which previously, again, you need to do a lot of work before you get to that, but at least we are able to give them indicators around here are the other things that needs to be checked. And back to the example of stress and adrenal, this is where you can ask for additional tests with adrenal function and see how that's performing, and how do you then boost the natural function of the adrenal glands. Similarly, there are benefits to the patient as well. I think the big one I'll call out is around how do you engage a patient, and enabling the patient to use sort of like a gamified approach to do certain activities, or remind them of the, let's say, medication, or create programs which help them to do a lot more self-care around this as well. So I think that's another big piece. So I'll skip through a couple of slides, but this is basically the product that we have, which is focused on driving the continuous self and guided care with a deep-rooted focus on clinical aspects and delivering the whole person care approach in this space. I'll pause and I'll take questions if anybody has any questions.